Good evening, Professor. This video is about the awareness in regards of coronavirus 19. We will tackle the origin of the virus, the characteristics, its symptoms, the impact when the virus began, and its remedies. Since the new coronavirus began infecting people last winter in China, scientists have been working non-stop to try to figure out how it spreads. The mysteries they are still trying to untangle is when this virus came from in the first place. Zoonotic disease is on the rise as interactions between humans and wildlife increase. Food and agriculture practice, wildlife and livestock trade, all these things put humans in closer contact with animals, especially in densely populated areas. This creates a perfect zoonotic spillover for animal-borne disease to jump to humans, and with this coronavirus, the most likely origin point is bats. In NBC News, Dr. Richard says he's 96% confident that coronavirus came from the bat. Initially, researchers looked for clues about the virus origin at the Hunan Seafood Wholesale Market in Wuhan, because the market was connected to many of the early infections in China. In fact, it took various hunters over a decade to track down true origin of the 2003 outbreak SARS. Hunting viruses is a time-consuming and expensive endeavor, and while technology has improved in the last 17 years, there still aren't many shortcuts to the detective work of tracing a virus to its source.
As of now, October 13, 2020, there have been 38,040,148 cases of coronavirus in the world. 28,598,151 of it were recovered, and 1,085,373 were dead. In the Philippines, there has been an increasing count of coronavirus cases, which have led to multiple lockdowns in some areas of the country.
Coronavirus or COVID-19 is a small bacteria and an infectious disease that can be seen by our naked eye. These small bacteria can be transmitted by our saliva, which you can feel the symptoms within 14 days. There are two subclinical infections of COVID-19, and those are symptomatic and asymptomatic. Asymptomatic is a person that has become infected but with no signs of symptoms, while symptomatic is a person that has become infected with signs of symptoms. SARS-CoV are characterized as a crown-like spikes in the outer surface of the virus, and that is called coronavirus disease 2019. Coronavirus disease 2019 are mainly characterized by high fever, sore throat, shortness of breath, and fatigue. Nature of COVID-19 is a highly transmissible and pathogenic, and it attributes to the body of a person which it is dangerous and it can lead to death.
COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms: fever, dry cough, and tiredness. Less common symptoms: aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin, or discoloration of fingers and toes. Serious symptoms: difficulty breathing or shortness of breath, chest pain or pressure loss of speech or movement. Seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home.
According to Coronaphilic 2020, that coronavirus has its positive and negative effects. The positive effects of coronavirus is that medical systems in any country will be improved to sustainable levels to face a pandemic situation. Second is the reduction in crimes such as drug addiction, alcoholism, gambling, and many more. The negative effects of coronavirus is that the high rate of deaths due to various illnesses or complications of diseases occurring amongst the patients. Second is the dismantling of the family relationship and intimate relationships with relatives, neighbors, and various communities. And credits to
the government is still in search for the COVID-19 vaccine. However, if you feel sick, call a medical expert, and while waiting for a response, isolate yourself. Drink plenty of water. Eat nutritious food such as vitamin C-rich food. Disinfect regularly, and always follow the government's advice.